Hello, and welcome to Ascensa Health. My name is Andrea McClarty, and as the Director of Administrative Services, I have the honor of welcoming you aboard as you join our team of dedicated professionals in the substance abuse field. To start, let me give you a little background into the agency. Our agency was founded in 1962 as St. Jude's Recovery Center. Over the years, we have grown from one facility to owning and operating 8 facilities in the Atlanta area. In January of 2020, as part of our strategic plan for growth, we rebranded and are now Ascensa Health. And although our name is different, we continue to serve the greater Atlanta community by providing high-quality substance abuse and co-occurring disorder treatment to vulnerable populations such as homeless and low-income men, women, and women with their dependent children. Our mission is to provide a behavioral health system of care that sustains recovery and returns individuals to their families and communities. Ascensa Health provides clients with services designed to meet the needs of all 8 areas of wellness. Services range from intake and assessment, health services, detox, psychoeducation groups, individual, group, and family therapy, 12-step education, employment services, and more. We believe in a person-centered philosophy and are committed to providing a safe, welcoming, and therapeutic environment for all persons. We use evidence-based practices to provide treatment services based on the disease model of addiction, and like I said before, we're focused on treating the whole person. Our agency provides a full continuum of care from detox all the way through permanent supportive housing. So those programs that we provide are detoxification, residential, and day treatment services. Day treatment also can be outpatient treatment. We provide medication-assisted treatment for individuals with opioid use disorder, and we also provide recovery residences. So we're going to go through each one of these individually. Our detox unit is a 24-bed co-ed unit for clients who are in withdrawal or in imminent withdrawal from alcohol, opiates, or benzos. So for many, this is the beginning of their recovery journey, and therefore this program starts with basic education on addiction and recovery. The clients get a lot of case management services that are designed to ensure that they are able to transition to a recovery supportive environment after their stay in detox. Our residential programs include a men's program, a women's program, and our family care center, which is for women with their dependent children. Each of these programs are approximately 6 months and include an intensive day treatment phase, a job search phase, and an employment phase. These programs are designed to transition clients through the recovery process and give them the tools necessary to become healthy, self-sufficient individuals in recovery. Ascensa Health has 2 recovery residences for clients who have completed our residential program. Now, the great thing about these residences is that clients are able to reside in there while still staying connected to their program. So they're still able to participate in the continuing care groups and evening groups. They're still able to come to on-site meetings as well as meet with their clinician for individual sessions every month. And it all starts here at the healthcare center. So the healthcare center not only houses our admissions and health services team, but they also house our employment services and the medication-assisted treatment program. So it's a very busy building. Services for clients are coordinated by a multidisciplinary team that includes residential managers, clinicians, training specialists, nursing and employment services team members, and each client receives an individualized treatment planning centered around their goals for recovery. Now, about our agency structure is pretty simple. Our agency is governed by a board of directors. They don't have anything to do with our day-to-day operations. That is all managed by our CEO, Suzanne Schaefer. Suzanne oversees the three of us, our CFO, who is Sue Wiggin, who in turn oversees what I like to call all things numbers. That's our accounting, our technology, our outcomes, our performance measurement and management system. So she oversees all of that. She also oversees our VP of Clinical Services, Rusty Gray. Now, Rusty in turn oversees all of the clinical service managers, the program coordinators, director of nursing, and they oversee the clinical staff, which are 95% of our staff are the clinical staff. So that's going to be our residential staff, our clinicians, employment specialists, nurses, all of that. And then there's me, the Director of Administrative Services, and I oversee aspects of the agency such as human resources, regulatory compliance, food services, other administrative functions, and of course our administrative staff. At Ascensa Health, we operate off of a set of plans. The strategic plan is our vision casting plan. It's generally a 3-year plan, and so that takes into account a lot of different information when we're creating that plan, both from what our goals are as an agency, but also what the community needs are and what we project those community needs to be, because we're always wanting to meet the needs of the community. The risk management plan addresses any concerns or risks to the agency or anything that would stand in the way of us achieving the goals in our strategic plan. The accessibility plan addresses and seeks to overcome any barriers to treatment. And the technology plan focuses on the safe and acceptable use of technology to provide services, and the cultural competency plan addresses cultural considerations for providing treatment services. We also have a performance measurement and management plan, and that plan helps us gauge how effective and efficient, as well as how accessible our services are, and that can be both clinical and administrative. So we collect data from various sources and use that data to report our progress quarterly at our Performance Improvement Committee meetings. In those meetings, we celebrate our successes, but we also address any areas of concern through action plans. And all of that comes through the outcomes and data management program that we have, which directly ties into the performance measurement and management plan. The great thing is that we have dashboards, and these dashboards are located on the J Drive. They house basically a snapshot of the data and information. So anything that you would want to know about a program, say how many clients use the emergency room, how many clients are compliant on their medications, what percentage of clients exit to permanent housing, what is an average length of stay in each of the programs. All of that is on our agency dashboards, which are on our J Drive, so very accessible to all of our staff, and we really encourage our staff to go in. They're updated at least quarterly, if not monthly, so you can see the information pretty quickly to know how your program is doing and how other programs are doing. So that's a great way of just kind of keeping up with, like I said, just how your program is doing. So our core values, the performance measurement and management and the Performance Improvement Committee, this is just one way that we demonstrate our core values of commitment, accountability, mutual respect, and excellence. And these are things that we actually are very, very big on. We want to make sure that our staff are demonstrating these values, that they're modeling these values day in and day out. So these are really, really important. You'll find these posted in our buildings as well. So now that you know a little bit about the agency, here's what to expect during your first week of employment. Starting a job can be exciting, but it can also be a little nervous. So to help, let me share with you what to expect as you join our team. In your welcome email, you should have received an employee handbook. It is Very important. I cannot stress this enough. It is very, very important to read the employee handbook prior to your first day. The employee handbook has lots of valuable information in it, such as the dress code, which is business casual, more business than casual, employee attendance policy, professional development, and general conduct policies. Now, in your first week, you're going to undergo an orientation both with some members of our team and your supervisor. You'll get to meet with your supervisor and share scheduling and contact information, as well as tour your facility and just get familiar with your workspace and your team. You'll also learn how to clock in and out in ADP. And if you're a residential staff member, you will engage in about 3 training shifts in your primary location, and then you'll have the opportunity to cross-train in other departments if you're part-time and PRN. Now, full-time staff will receive a set of keys and will be assigned a parking space as well. You should receive an email with information on training requirements that are due within your first 60 days. You'll get that email, you should get it within their first week of employment as well. So the first, I would say 30 days is a really busy time. And we are here to support you as you embrace your new role. If you have any questions, please don't hesitate to reach out. You can reach out to your supervisor or myself for help. And just kind of some other really important things to note as you join our team are items such as getting paid and the dress code and professional development. So I would just kind of touch on these things very quickly. Again, they're in your handbook, but want to make sure that we go over them. So schedules, your supervisor is responsible for making your schedule. If you are going to be absent or you're going to be late, you need to call your supervisor, not text or email, but call your supervisor no less than 2 hours in advance of your scheduled shift. That's really important. We do expect that staff will be on time for their shift and that you will work the entire shift. So if you have an emergency, please call your supervisor and let them know. Now, just FYI, if there's a pattern of missing shifts or tardiness, that can be cause for termination. As far as timesheets go, once you complete your onboarding in ADP, you will use that login to clock in and out or complete your timesheet. Employees are responsible for ensuring that their timesheet is complete and accurate in ADP, and you can do that by logging in and checking your timesheet. And I actually recommend that you do that each day so that if there is an error, it can be corrected immediately. Now, if you have an issue with ADP, take a screenshot and send it to your supervisor right away. Employees get paid twice a month, on the 15th and on the last working day of the month, and the pay periods are outlined in the employee handbook. Dress code. I touched on this before, but the agency has a business casual dress code. This slide right here shows what we would consider appropriate attire for work. And jeans are only allowed to be worn on Fridays, and all attire must be neat, free of holes or tears, and not be faded. Just remember that we're a professional environment, and although our dress code is business casual, like I said a second ago, it's more business than casual. So this slide shows some examples of what not to wear. Attire not allowed includes athletic wear, leggings, yoga pants, flip-flops, t-shirts, and hoodies, or any clothing that may be considered revealing. As I mentioned before, training is an important part of staff professional development. Not only will you receive a formal orientation, but you will also receive department orientation and training. And additionally, each staff member must complete a training plan each year, and we provide that to you. And you also must keep your CPI and CPR first aid certifications current. So now that you have an introduction to the agency, take the next step in onboarding and complete your information in ADP, sign all of the documents, and upload any reference letters or college transcripts. If you have any issues uploading anything, including your emergency contacts, you can send those to me directly in an email. We look forward to seeing you soon, and don't forget to read the employee handbook.